My name is Melanie Morin, and today I'd like to talk to you about the important change in policy of care for bladder cancer patients who seek treatment and care in this urology practice. There have been difficulties in consistently following the established guidelines, which can affect patient outcomes and the quality of care provided. By reviewing the current practices and finding areas to improve, we can ensure that patients get the best support and treatments during their bladder cancer journey. During an interview with the Chief Operating Officer of the practice, the challenges of adhering to the established guidelines were highlighted. He noted that one provider expressed concern regarding the non-compliance with bladder cancer guidelines, and on a separate occasion, another provider echoed these same sentiments. Another recent interview led by the lead APP, which is the advanced practice provider, he expressed the same concern about non-compliance within the practice among the providers. He noted that the NCCN guidelines are the most frequently utilized standards and suggested that the implementation of a nurse navigator program might help address the issue of non-compliance within the practice. A survey was then distributed to the providers within the practice to engage the adherence to establish clinical guidelines concerning the bladder cancer engagement. The survey consisted of very straightforward information with a yes, no, or unsure of whether they felt like the practice providers were aware of the established guidelines for bladder cancer. And the results. The objective of the project is to improve compliance with the established clinical guidelines for managing bladder cancer patients within the urology practice by 10% over 12 weeks, specifically by reducing the incidence of missed follow-up appointments after bladder biopsy procedures. The goal of lowering the missed follow-up appointments after bladder biopsy procedures is to enhance the patient involvement. This would be achieved by improving communication about instructions and the purpose of follow-up appointments, as well as implementing reminders and outreach programs. We have done literature research on this topic, and the articles emphasize the importance of strict adherence to established guidelines to avoid gaps in care, which can lead to poor prognosis and lower survival rates. Also notes that maintaining compliance is not only beneficial to patient care, but also serves as a cost-effective strategy for the healthcare system. Research has provided that around 71% compliance is what is needed to be committed to guidelines. However, the complexity of the bladder cancer guidelines document that it hinders the consistent application of the treatment protocols. Model that I would like to use for this project would be the PDSA model.
P, plan. We will add a nurse navigator to the program with a physician champion. D, do. This is the implementation part of the model. All patients scheduled for a TURBT in the practice will be tasked to the nurse navigator. The nurse navigator will ensure the patient has a follow-up appointment in the office with their provider after their TURBT within 7 to 10 days. The nurse navigator will flag the positive pathology results and add it to the shareable tracking sheet. The nurse navigator will check the chart to ensure that the care plan is established for the patient at the time of the follow-up visit and confirm this with the ordering provider. The care plan will be reviewed with the physician champion to make sure it complies with the NCCN guidelines. In the event that it does not comply with the NCCN guidelines, the quality committee for the practice will then review the patient's chart. The nurse navigator will contact the patient to discuss their care plans and arrange for any further follow-up. S, study. We will analyze the data to see how many more patients were scheduled for follow-up appointments with the Nurse Navigator program. A, act. We will make changes to the program based on these study results.
Through this initiative, the practice can enhance both the provider knowledge and the patient outcomes, ensuring patients with bladder cancer receive high quality and evidence-based care they deserve. It has potential to create a significant improvement in patient management and engagement.